You will open your files. Okay, first, brain is subdivided into three major parts: the cerebrum, the brainstem, and the cerebellum. Further, the cerebrum is divided into four major lobes: frontal, parietal, occipital, and temporal lobes. Each lobe has different functions, and these functions are the frontal lobe is responsible for higher mental functions, eye movement, and other cognitive abilities. Now, the temporal lobe is responsible for the emotions. The parietal lobe is responsible for the sensory and somatosensory association, and the cerebellum is responsible for the coordination of movements. Here is another view of the brain. As you can see, these are the same functions which I mentioned a while ago, except here we can visualize the language comprehension area in the parietal lobe, which is also known as the release area. Okay, from the base of the brain, you can see the inner aspect of the temporal lobe. The temporal lobe is the relay center for the sense of smell. We now proceed to the diencephalon. The diencephalon is divided into the thalamus and the hypothalamus. The thalamus is the relay center of all sensations except smell. Now, the hypothalamus is the part of the brain that regulates the pituitary gland. Now we go to the brainstem. The brainstem has three parts: the midbrain, the pons, and the medulla oblongata. The midbrain is the reflex relay center. The pons is responsible for the respiration, and the medulla oblongata is responsible for respiration, heart rate, BP, and swallowing. We proceed to one significant part of the brain, which is directly relevant to the case of the patient: the basal ganglia. The basal ganglia is located at the base of the forebrain. It is strongly connected to the cerebral cortex, thalamus, and other areas of the brain. Now, here are the functions which the basal ganglia is responsible for. First, involuntary motor control, procedural learning related habits and routines, cognitive functions, and emotional functions. Another vital aspect of our study in terms of anatomy and physiology is the cerebral circulation. You see, the brain has a quadrilateral blood supply. It is supplied with a common carotid artery and vertebral artery, which branches out to the anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. When the blood flow in the brain decreases to less than 25 ml per 100 grams of brain per minute, stroke occurs. Okay, so for the patient's case, the part or the artery that was blocked with, or the infarcted part is the middle cerebral artery. Okay, we proceed to the pathophysiology of CBA. First, we begin with the modifiable factors. The patient has been diagnosed with hypertension when she was 60 years old. The patient has been diagnosed with diabetes mellitus type 2 when she was 40 years old. The patient lives a sedentary lifestyle and is not active at home. The non-modifiable factors are age. The patient is gender and heredity. So the patient is 70 years old, which makes her a susceptible candidate for CBA. Now, the patient is female. We all know that CBA and hypertension is more dominant in males. But since her age is 70 years old, it's now hereditary. The patient has hypertension in both sides of her family. So the pathophysiology of CBA develops from the formation of plaque deposits in the patient's glomerulus aorta. So these formation of plaque predisposes the patient to hypertension, thus leading to CBA. When the atherosclerotic plaques rupture, thrombosis occurs. When thrombosis occurs, occlusion of major blood vessels happens. The thrombus rises from the walls of the endothelium. When the thrombus slices from the walls of the endothelium, the vessels become weak and fragile walls. This leads to leaky vessels, which therefore starts the clotting cascade. So here we can see that the embolus has already lyse from the thrombus and is leading to the circulation to the brain. These blood flushes into the cerebral arteries. Good question, Kate and Taga. We will come to that. These happen when there is an obstruction in the blood supply to the brain. First, there is cerebral hypoperfusion because the blood cannot flow to the brain. And since the blood supplies the nutrients that the brain needs to function, there will be an impaired distribution of oxygen and glucose, thus tissue hypoxia and cell starvation. Cerebral ischemia happens when there is an obstruction of the blood vessels of the brain. When this happens, and the mitochondria switches to anaerobic metabolism. When the mitochondria switches to anaerobic metabolism, there is abnormal production of lactic acid, thus leading to metabolic acidosis. Now, when the mitochondria shifts to anaerobic metabolism, it also loses the capability to produce enough ATP to power the depolarization process. When there is decreased production of ATP, there is also an increase in glutamate and an influx of calcium. When this happens, it leads to the formation of free radicals, which then damages the blood vessel endothelium. Hence, stroke.